Good morning everybody and thanks for coming along for today's educational video. For today's topic we are going to be. Hang on. Before we begin, could I just ask you to put your phone away please, Mrs. Smith?
Sorry, Lily. No problem. Please continue.
Thank you very much. As I was saying, today's topic is going to center around discussing the signs and symptoms of bipolar disorder. Before we begin, I would just like to let everyone know that today's topic will only be based around understanding and spotting the signs. We will be discussing ways to help a child with this condition in tomorrow's lesson. Before we start to talk about some of the symptoms of bipolar, I would like to firstly ask if anybody already knows much about this condition.
I think I've heard about this before. Is this the same condition as borderline personality disorder?
That's a good question, Mr. Brown, and I can understand why you would think that. But no, bipolar disorder is completely different to borderline personality disorder, but they do share the same acronym, which is why some people get confused. Borderline personality disorder is also known as emotionally unstable personality disorder, but we will discuss that in a different video. Bipolar disorder is a mental health condition that affects your moods, which can swing from one extreme to another, and it used to be known as manic depression. The main trademark is big changes in a person's mood from mania to depression, which basically means that it is very common for someone who has the condition to experience states of incredibly high and happy moods as well as depression. It can certainly be a very difficult condition for anyone to manage. Symptoms of bipolar disorder depend on which mood you're experiencing. Unlike simple mood swings, each extreme episode of bipolar disorder can last for several weeks or even longer. Professionals often refer to the manic depression phase of bipolar as a dip or a crash, and it's normally easy for a person with the condition to spot the signs themselves when this is about to happen. Other potential symptoms that may indicate the presence of a psychiatric disorder requiring evaluation may include feeling trapped, overeating, excessive worry, and anxiety. Other possible diagnoses in addition to bipolar disorder that should be considered in the setting of symptoms such as these include unipolar, major, depression, anxiety disorders, substance use disorders, adjustment disorders, and attention deficit hyperactivity disorder. As you can probably see for yourself, this is very difficult to diagnose. And unfortunately, bipolar disorder in teens frequently goes undiagnosed and untreated. Partly, this is because while symptoms may begin in adolescence, they often don't meet the full diagnostic criteria for bipolar disorder. Some experts think that bipolar disorder also can be overdiagnosed in children or younger adolescents, especially when symptoms involve just mood swings or disruptive behaviors rather than changes in energy or sleep patterns. Other symptoms may include, but are not limited to, uncharacteristic periods of anger and aggression, grandiosity and overconfidence, easy tearfulness, frequent sadness, needing little sleep to feel rested, uncharacteristic impulsive behavior, moodiness, and confusion and inattention. It's also very common for a person with bipolar to engage in risky behavior, like having impulsive sex, gambling with life savings, or going on big spending sprees. You may also notice that they are talking very fast, often with racing thoughts and rapid changes of topic. Feeling jumpy and weird or feeling overly happy or high for long periods of time, and in some extreme situations people have even been known to hear voices in their head. That's all the time we have for today's lesson. But I do hope that everyone found this information useful, and it would be great to see everyone back at the same time tomorrow morning so that we can share a load of tips and advice on how you can help and support a child who has bipolar. Above all else, please remember that there is nothing wrong and nothing to be ashamed of by having this condition, or any other mental health condition. And please always do your best to let your child know that they are loved and they are more than capable of living a full and happy life. If you haven't done so already, then please remember to subscribe to our channel if you are new and hit the bell icon so that you never miss any of our videos.